Hello everyone, how are you doing? Welcome back to my channel. When you want to simplify medical concept for your exam, and if you are medical student preparing for comprehensive, exit or COS exam, you are in the right place. So don't forget to subscribe my channel for accessing related video. This is obstetric related question. Question number 1. During the third stage of labor, your patient's uterus inverts and the placenta became detached from the uterus. Which of the following is the next best step in the management? A. Prompt oxytocin administration. B. Attempt to replace the uterus manually. C. Prompt hysterectomy. D. Administration of inhalation of anesthetic period. Think over it for 5 seconds. The correct answer is attempt to replace the uterus manually. Question number 2. A midwife assists in vaginal delivery of newborn infant. After the delivery, the midwife observes the umbilical cord strings and spurts what we call it gush of the blood from the vagina. The midwife documents this observation as the sign of A. Hematoma. B. Placenta previa. C. Uterine atony. D. Placenta separation. The correct answer is placental separation. D. Number C. A client arrives at the delivery center in active labor. Her membranes are still intact and nurse midwife prepared to perform an amniotomy. The nurse who is assisting the midwife explained to the client that after this procedure she will almost likely have A. Less pressure on her cervix. B. Increased efficiency of contraction. C. Decreased number of contraction. D. Need for increased maternal blood pressure monitoring. Think over it for 5 seconds. Correct answer is B. Increased efficiency of uterine contraction after amniotomy. Amniotomy because there is prostaglandin released from the membrane after rupturing of the amniotic fluid. Question number 4. A pre-gravid client admitted to labor and delivery area and assessment revealed fetal malpresentation and yellow amniotic fluid and fetal heart rate of 98 beats per minute. What should the nurse do? A. Increase the IV oxytocin flow rate to hasten labor and delivery. B. Reassess the client for continued normal finding in 15 minutes. C. Help the client into the position for delivery. D. Notify the physician and the surgical team of an emergency. Think over it for 5 seconds. The correct answer is D. Notify the physician and surgical team of an emergency because there is the fetal heart rate is below the baseline, lower from the baseline, and there is also fetal malpresentation. So the correct procedure is cesarean section. Question number 5. A client admitted to the facility in the preterm labor. To halt her uterine contractions, the midwife expects the physician to prescribe A. Betamethasone, B. Dinoprostone, C. Ergonovin or ergometrin, D. Ritodrine. Think about it for 5 seconds. The correct answer is D. Ritodrine. Question number 6. A client membrane ruptured during 36 weeks of pregnancy. 18 hours later, the nurse measured a client's temperature at 38.8 degrees Celsius after initiation of prescribed antibiotic therapy, the nurse should prepare the client for A. Amniocentesis, B. Delivery, C. Sonography, D. Tocolytic therapy. Think over it for 5 seconds. The correct answer is B. Delivery, because there is what? Chorioamnionitis. There is the infection 38 because the temperature is at 8 degrees Celsius, and also membrane rupture for 18 hours. There is a chance of chorioamnionitis high. So the best treatment for this patient is delivery after antibiotic therapy. Question number 7. A nurse is monitoring a client labor. The nurse suspects umbilical cord compression if which of the following noted on external monitor tracing during a contraction? A. Early deceleration, B. Variable deceleration, C. Late deceleration, D. Short-term variability. Think of it for 5 seconds. The correct answer is B. There is variable deceleration. The cord compression cause for variable deceleration. The variable deceleration associated with cord compression, early deceleration associated with head compression, and the late deceleration is associated with insufficiency of the placenta. Insufficiency of the placenta, or calcification related with calcification of the placenta almost. That's that one. And question number 8. A midwife in postpartum unit is caring for a client who has just delivered a newborn infant following the pregnancy with placenta previa. The midwife reviews the plan of care and prepares to monitor the client for which of the following risks associated with the placenta previa. In short, what is the risk associated with the placenta previa? A. Disseminated intravascular coagulation, B. Chronic hypertension, C. Infection, D. Hemorrhage. Think about it for 5 seconds. The correct answer is hemorrhage. Hemorrhage is mostly associated or high risk factor with the placenta previa. Question number 9. According to Naegele's rule, which of the following is expected date of delivery for client whose last normal menstrual period occurred from April 5 to April 10? A. January 9, B. January 12, C. January 16, D. January 23. Think over for 5 seconds. The correct answer is January 12, because if you want to add 7 on 5, you can get 12 and subtract 3 months from April, January, and you can add 1 year or expected date of delivery. Question number 10. Which fetus has the least chance of developing respiratory distress syndrome? Least chance of respiratory distress syndrome. A. Diabetic pregnancy, amniotic fluid, lecithin sphingomyelin ratio is 1.5 to 1 and the prostaglandin is absent. B. Diabetic pregnancy, amniotic fluid, lecithin sphingomyelin ratio is 2 to 1 and the prostaglandin is absent. C. The diabetic pregnancy, amniotic fluid, lecithin sphingomyelin ratio is 3 to 1 and the prostaglandin is present. D. Preterm pregnancy, amniotic fluid, L to S ratio is 1.5 to 1, prostaglandin is present. Think over it for 5 seconds. The correct answer is C, because there is the presence of prostaglandin and lecithin sphingomyelin ratio is 3 to 1. Lecithin sphingomyelin ratio higher. So the chance of respiratory distress syndrome is low. Or it is enough for today. Thank you very much for listening to me. Don't forget to subscribe my channel for accessing the related videos. Thank you very much. Have a nice time.